So there are two types of augmented feedback. The first one being KR for short, being knowledge of results, and the second one being KP, which is knowledge of performance. And basically, each category involves a variety of ways of presenting augmented feedback. So the first one we're going to go over and describe is KR, which is knowledge of results. So essentially, KR is externally presented information about the outcome of an attempt to perform a skill. So information provided to the learner about the outcome of the attempt and whether or not they were successful or not. So generally speaking, KR is the outcome of your results, and it essentially provides performance outcome information. And it also can describe whether or not the athlete has or has not achieved the performance goals. So for example, we can go over a powerlifting athlete within a competition setting, whether or not they achieved all three white lights. That can be an example of KR, whether or not they were successful or not. And in general terms, speaking with other sports, it can also be generally associated with a number. Some relations to other sports, it can be how far you threw the football during an in-game competition setting within football, like on the field, how fast you ran the 400 meter during a track competition, or how many points you scored as an individual player during a basketball game. That's generally what KR is, the knowledge of your results, and it focuses more on the outcome instead of the movement. And that's the distinct difference that comes in with knowledge of performance, which is KP. So in difference between KP and KR, KP gives information about the movement characteristics that led to the performance outcome. So main difference between KR and KP is it differs in terms of which aspect of performance the information refers to. So for KP, it's the technique being used, critique on technique being used, form of the movement, focusing on the movement itself and not the outcome. So for example, an example of KP would be seeing an athlete squat or deadlift. We can review their technique, critique that, and essentially we want to critique that, have them perform the exercise or the lift with the most optimal and efficient form so that we can prevent injuries and basically keep the athlete safe. And there's different types of KP. There's verbal KP being descriptive, which is saying what the person has done, and then there's prescriptive, which is what they have to do. So that's essentially giving tips or critiquing that athlete's form or technique. Then there's manual guidance, video replay, movement kinematics and kinetics, which is just the characteristics of that. And then there's biofeedback as augmented feedback in clinical environments. And that is the difference between KP and KR.